So, hi everyone. Thank you for joining us. We're going to go ahead and get started, and I want to welcome everyone to our installment of Conversations in Care, an initiative by the Jackson Health Foundation to share the latest healthcare news and breakthroughs with our supporters. I'm Flavia, and you all know who I am, so I'm not going to go ahead and introduce myself. Our topic today is you and your heart, and we always want to share what's most relevant with our supporters. So we're really happy to have joining us in our conversation today the Chief of Cardiac Surgery for Jackson Health System, Dr. Romualdo Segurola, also goes by Peter, and he is also the Medical Director for the Jackson Heart Institute. So I'm delighted that you're here and you're joining us today and share information on topics that are important to us all. So we want to do a short introduction of Dr. Segurola, so we're going to play a video now.
There is nothing more rewarding than when you connect with that patient. The patient is putting the trust in you to put him through a very difficult experience, such as heart surgery. I'm Dr. Romualdo Segurola. I'm the Chief of Cardiac Surgery for Jackson Health System. My expertise in the field of medicine is in cardiothoracic surgery. I'm an expert in heart surgery. In particular, I spend most of my time, however, doing minimally invasive heart surgery. Jackson is a friendly place. Yes, it's a big place, but it has great people, great professionals. It is a stellar institution, internationally known. It has trained so many people. Yes, we are big. Yes, we are special, but we're also a community hospital serving our community. It invigorates me when you have a multi-ethnic community. There's a large portion of the community that is of immigrant means, and that gives us a common thread. This is where my roots are. This is a community that I love, and helping our community, like the community helped me to get to where I am, is very rewarding. The most important thing of the care of your loved ones is one basic principle. Find a doctor that cares.
Excellent. What a nice video and an introduction piece. Before we get started with the questions, we know we're going to focus on the heart. Is there an opening statement or anything that you'd like to say just in general?
Well, I would like to welcome everybody for joining us this morning. It's all a testament how we're all very concerned nowadays with heart care and our overall care of our bodies. I mean, that level of education has really changed in the last 20, 30 years. And we see it in all sorts of ways. So the fact that we can continue that journey, educating our community and our community taking more responsibility for their health care, I think is something really remarkable.
Agreed. I couldn't agree more.
It's a partnership between your healthcare professionals and you as a patient.
And I think also the dynamic of the difference between how women respond to cardiac health, right? And men respond to cardiac health. I understand and we'll talk about that a little bit more, but there's different symptoms that they should be looking out for and different ways that they kind of approach their healthcare status and things like that. So I'd love to learn a little bit more about the dynamic between the two and how that works. But what are the top 3 things that an individual can do to improve their cardiac health? Like if I know nothing, right? And I speak to you, what are the top 3 things that I can do?
You know, the number one is activity. Some type of an exercise regimen, maybe not every day, but every other day, something practical. If you have a certain age, you should get cardiac clearance from your cardiologist before you start your training. Number 2 is your diet. And the whole thing starts with the inflammatory response of fats that we eat. Really decreasing the fats that we eat is something that is extremely important, that really derails this whole thing into a healthy lifestyle. And 2 is, and lastly 3, is if you have already predisposing condition, the silent killer, high blood pressure, for instance. You really want to treat that, because that really can make all the difference in your life in reference to strokes, renal failure, heart failure, etc. I would probably start with those 3 things, It's really a holistic approach to everything. It's not one element is the go-to-all element. It's a series of things that work together, and it makes all the difference.
And when you say exercise, something as simple as walking, does that suffice, or does it need to be something a little bit more rigorous?
There's different ways of walking. So I tell my patients, you have to be pragmatic, and it's practical, and what works for you might not work for anybody else. So let's say that you never exercise and you're very sedentary. If you just start walking, just normal walking, that already starts making a great difference. And then that would just challenge you to do more and more. I think that what you don't want to do is, if you don't really exercise, you're a busy professional or you're a busy house mom and you have 5 kids and you have to do all these things. What you want to do is, you don't want to just jump into the gym and let me just get a trainer and I'm going to be an athlete. Just be pragmatic, because if you're not pragmatic and if you don't do it in a stepwise fashion, it'll just be a turn-off. It's just one more thing to do instead of one more pleasurable thing to do. So that's what I would say. Just take it easy, do one thing at a time. Sometimes you get involved the family, but it doesn't have to be extremely vigorous. It has to be just enough.
And in this community that's so diverse, right, with regards to diet that you said, so we have a lot of different ethnicities here, a lot of different ethnic foods that everyone eats. And I know from my own experience and my ethnicity, right, and being Hispanic and Cuban, that a lot of that food isn't the best for you. What is your recommendation when you have all of these diverse patients that come to you?
Well,
how often can they
So you're posing
engage in that activity?
You're posing an interesting question, which is all the ethnic groups.
Right.
So let's just give a simple answer that involves all the ethnic groups. Stay away from fried foods.
Okay.
That's simple,
Right.
And I think everybody could understand that. But it doesn't mean that you never eat fried foods.
Okay.
Again, pragmatism. You can have one day of the week that you can be naughty about yourself or about your diet. That's fine. But eating fried foods every day, eating fast foods every day, eating foods with a lot of sodium, which is salt, these things will make a difference, especially after you get into your 50s. All these things really start catching up to you. The difference between living into your 80s and into your 60s without major medical problems is just doing the basic things. It'll make all the difference in the world.
Now, I know you mentioned high blood pressure, but what I hear a lot of too is high cholesterol, right? And how does that affect your heart health? Would you say that that's also one of the components?
Of course. So a high cholesterol is extremely dangerous, and there's such great drugs that you can use for that. But even before that, you just don't have high cholesterol, and you're going to go on medication. You're going to go see a doctor. They're going to do basic lab work on you. They're going to modify your diet, maybe give you some organic medications. You start losing weight, you start exercising, and sometimes that's enough. It's when all that fails that then you start with the medications. But the fats, that's the beginning of, for lack of a better phrase, the firestorm in your blood vessels. It starts accumulating in your blood vessels. That creates inflammation, and then we end up with what we hear, which is atherosclerosis. It's just a catch-all that is just hardening of your heart blood vessels.
Right.
If they're in your heart, maybe that can lead up to a heart attack. If it's in your brain, it can lead up to a stroke. But that doesn't happen in a month. That's over a 10, 15, 20-year period. So, and that's what we've seen. The population is way more educated. It starts from schools. My kids, early on, they were way more conscious of their diet than I was.
Same here.
And they were taking a really important measurement. So it's telling you how the community is changing. Okay, now we're fortunate that, we're probably a little bit more affluent than the average person, but there's a very needy population that even these basic things like in school and so forth, they don't have access to them.
Right.
And they're the ones that when they get to the hospital, they're really sick.
They're very sick.
And the options that they have are then limited as compared to somebody that has really been taking care of themselves for a long time.
Right. No.
And it's
I'm
no
sure.
fault of their own.
Right. No, understandably so.
Because nobody wants to get sick.
Yeah, I mean, even with, healthy food, right? It's what you go to a fast food restaurant, a chain, you can get like a burger, fries, and a soda for a couple bucks. But to eat healthy, it's oftentimes a little bit more expensive, right? To buy the fruits and the vegetables and things like that. So even in that arena, it's hard.
As a general rule, try to stay away from fats and try to stay away from carbohydrates, which are the sugars. Those simple maneuvers over a long period of time really makes a tremendous difference in your health. Becoming a pre-diabetic, becoming a diabetic, okay, having high cholesterol levels. I mean, it starts with one self-awareness and saying, I want to do something.
Excellent.
Preventive medicine is always better than curative medicine.
No, absolutely. Couldn't agree more. What symptoms should one be looking for, and when do they need to notify their doctor? So what do I look for if I think I may be having some type of heart condition and I need to go see someone?
In reference to your heart, the one is shortness of breath or weakness. Now that weakness, for example, it's very subtle because these things happen over a long period of time. But let's say that you walk, and you usually walk 3 or 4 blocks, and all of a sudden you're getting winded after 1 block. You're still walking,
right?
But the distance has just changed. Okay. That's a warning sign. Nobody should have chest pain or some type of chest discomfort, especially if you're doing some type of activity. That's a warning sign. For females, unlike males, shortness of breath is something to be concerned about. That's an early indicator of coronary artery disease. Okay? And the more traditional sign, which is chest pressure. But it's much simpler if you're having any one of these things to go see your primary care doctor. And then from your primary care doctor, then he'll decide if you need to go see a cardiologist or not. That's simple, and it really makes a big difference versus, this is just going to go away.
Sure. And I've always heard about pain. Is it in your left arm? Like, have you experienced pain in your arm?
It's traditionally more your left arm or your jaw, but it can affect your right arm.
Okay.
So it's better to look at it this way. It could be your right arm, your left arm, the back of your head, your jaw. It's something that has never happened before. If it happens and it's never happened before, it's something that you want to look at. It's something that changes.
Right, something difference.
Let's say you have arthritis and you're used to having some type of pain in your left arm. But now the quality of the pain changed. It used to be an achy type of pain, now it's a burning pain. That change in quality, that's a signal. Okay, so it's not so much the symptom, is when the symptom changes. Maybe you were having pain just early in the morning, now you're having it 3 times a day. Now the frequency changed.
Sure.
Catching these things early on gives you time to derail the process. Because the majority of patients that we see is too late. But when we see the patients early on, I mean, things are really curative. You can go back to just an unrestricted lifestyle.
That's amazing. That's great that we're able to, with the medical care do that. If you have questions, feel free to put them in the chat and we'll answer all those questions as we go along. And we'll get you answers on those. Another thing I wanted to ask is, what is it that patients should be asking on their initial visit or consultation? So they've gone to their primary and now they're at the cardiologist, right? What should they ask?
Well, the basic question is, if I understand your question correctly, they should have a really intense conversation about their diet. They should have an intense conversation if they have blood pressure or not, and how we're going to treat the blood pressure. I think that equally enough is, just because you go see a doctor and they put you on whatever the treatment plan might be, okay, you're being treated, but maybe you're undertreated. And that's very important. So what that means is, make sure that you have the follow-up visits every 3 months, every 6 months, and the abnormalities that they find, then they're corrected. Because this happens to a lot of people. The typical example,
Sure.
you are taking blood pressure medication, but it's still not controlled.
Right.
But you as a patient think, oh, no, it's controlled. I'm taking blood pressure medication. It might not be working. Maybe you need another medication.
Right.
Maybe you have to increase the dose. So follow-up is very important. It's not turning a blind eye or a deaf ear and just saying, oh, this is all taken care of. Things are very dynamic.
You have to be an active participant, right, in your
medical
earlier
care. Is the interaction between the healthcare providers and you as an individual patient.
How has COVID affected heart health? You know, we hear a lot on the news about long haulers and different things that may be affected. Is the heart part of that? How has all of that come to play during this pandemic?
Okay, so I think that the most important statement when it comes to that is that we don't know what we don't know.
Okay.
And I'm going to say a couple of things now. Those statements a month from now can change.
Right.
And people are really set on, oh, you said this or you didn't say that, and we see it in the news all the time. The thing is that we really don't know, and things are changing. And so with that said, and understanding that this is a moving target,
sure.
Okay, COVID is a bad player. And you have the acute affection of the heart, and you have the chronic long-term, and nobody knows the long-term. So there's going to be a lot of patients long-term that they don't even know it, that they're going to probably, and I'm using the word probably, go into early heart failure because of the effect of the virus on the heart per se. What those numbers are is really unknown. But acutely, it can affect the heart individually with, now ground zero is the lungs.
Right, okay. That's what I was going to say. That's what we hear about is the lungs.
But pretty much any organ can be affected. But you can affect the heart primarily by the virus affecting the heart cells, or it's just the intense inflammatory response in the body that it can affect the heart. Okay, it can precipitate a heart attack with atherosclerosis. It could affect the heart muscle per se, where it weakens the heart muscle. That's called myocarditis. It could affect the covering of the heart, which is the pericardium. That's pericarditis. So it's a whole spectrum. Okay, but it is serious when it does happen, and a lot of people, the majority, get through it. But what's going to happen long term, 5, 10 years down the line, that's anybody's guess right now.
And would you say that right now you've seen a vast number of patients that had COVID from the acute phase, right? That you've had to intervene with surgically?
No, you don't.
You don't. Okay.
So we try to find either medical treatments or interventional, like stenting and so forth. This is not only affecting your heart. So COVID isolated patient just affecting your heart, that's extremely rare. Okay, but if you're very aggressive in doing heart surgery on these people, what happens is that a vast majority don't do well, because we do have to paralyze the heart. We have to connect it to a heart-lung machine,
sure.
And that's just adding fuel to the fire. So if we can successfully treat you, wait a couple of months, then revisit the situation, you're going to have a far better outcome. Okay, but it's having to intervene in somebody with acute COVID. You don't want to find yourself in that situation. You know? Yeah, it's important when to operate, but it's more important when not to operate.
Right. No, absolutely. When patients come to see you, right, by the time they come to see you, would you say that the majority of them are in dire straits, or sometimes is it a minimal thing that just needs to be corrected? What is it that you see the most of in your surgical?
You know, it's probably 50-50.
Okay.
So the people that I see in the hospital, okay, those are people that had the event. You know, they went into congestive heart failure because of a bad valve that was going on for a long time, and they just didn't seek medical attention, or they had a big heart attack. That's one type of patient population. The other one are the ones that do come to the office. And those are the ones that are usually within a system with a primary care doctor, an HMO. There's some type of a medical system. They might have their cardiologist. They're tested and they find a problem before the problem became evident, before the heart attack, before the congestive heart failure. Those people usually have better options because the event, whatever that might be, hasn't happened. Okay, and that's what we usually see in the office setting.
And I've heard sometimes that you'll see, for men in particular, and I don't know if this is accurate or not, that men that are in their 40s, right, or early 50s that have a heart attack don't fare as well as someone that maybe has a heart attack that's a little bit older. Is there any truth to that?
Okay, that's empirical. That's not really scientific. What happens is, but I'll give it a little bit of a scientific twist. Heart disease really should happen in your 60s, 70s, if you do more or less the 86. But when it happens in a young person, two things usually are occurring. Either this is somebody that really has not taken care of himself at all, okay? In other words, we can say that as they're living the vida loca, okay?
Okay.
Or they just have very aggressive disease. Maybe really, for lack of a better phrase, really bad genes. So it is very aggressive. So maybe that's why they don't fare as well. But I have to tell you, in those situations, usually the surgical intervention takes you out of a life or death situation. The difference of that intervention working for 5 years, 10 years, 20 years is when you marry it to what's hardest, which is the change in behaviors, the change in your diet, taking your medication. There are some people, some patients that are evangelists when it comes to really doing a change in their lifestyle. And they'll go on to live a normal life. They'll lose all the weight. They'll change their diet. They'll never have another intervention again.
Right.
But that's far more important than the acute surgical intervention or a cardiology, a stenting type of intervention. What's hard is the marathon. Because I can tell you, we're probably speaking to a bilingual audience. There's a phrase in Spanish that goes, like something, I think I'm having a senior moment.
It's okay.
Okay, so it's con las glorias se olvidan las memorias.
Okay.
Okay, con las glorias se olvidan las memorias. So 6 months down the lines, you feel great about yourself, okay? And then you stop by La Carreta.
Yeah.
And you get your flancito, pastelito, and then that's just the process again. So, the glory, you forgot your memories, how sick you were.
Sure.
And then that derails the whole thing again. It takes enormous amount of willpower.
To maintain that.
There's no sense of reprimanding any patient. It's just really hard.
Sure. And when patients come to see you, I'm sure by the time they come to see you, they're anxious and they're nervous, right? Because they think, oh gosh, what is this going to lead to? What's the most common question that you get when someone comes to see you for the first time?
It's a very basic question. All comers, which is, am I going to survive? Because remember that believe it or not, their main concern is not, are they really going to survive? It's their responsibility to their wife, their kids, they're not ready to retire, whatever it might be. I mean, it's an extremely stressful situation. And even if you go through one of these procedures, okay, you just don't hop back on the horse.
Right.
I mean, there's a couple of months that are downtime, God willing that there's no complication, etc. And a lot of people can't. And this is very sad, but there's a lot of people that will not get any health care, okay, because they can't lose their job.
Right.
I mean, this is reality.
No, this is the world we live in, yes.
And if you put on a scale, putting food on your table, and there's a lot of people like that in Miami, they're going to continue to work, and as we hear all the time, se lo dejo a Dios.
Right.
This is reality. I mean, you can't blame that person. I mean, maybe you know better, but you're not really in their shoes.
Right.
It's
absolutely.
very
so
hard to be in those
able
situations.
to make that decision during that time. Let's look at some of the questions because I know I've been hearing some buzzing. So let's take a look at some of these questions that we've received. Here are some. And I didn't bring my glasses, so I'm going to have to open these up. Women and heart disease. Is there any correlation between heart issues and the onset of menopause? Could the heart be affected by hormonal changes?
So the short answer is yes. Okay. So heart disease is more premature and aggressive in general terms, men versus women, and that's the estrogen protection. But once they hit menopause, the curves start equalizing. So that protective effect that they had, a natural biological protective effect, it kind of like goes away, it tapers down. What's more important is that heart disease is a little bit different as it presents in women versus men. And men has the typical chest pressure or chest pain.
Mm-hmm.
We're talking in reference to the heart attack type of picture, the low-lying fruit. Women tend to feel more fatigue, a little bit short of breath. And again, it's not short of breath that you just can't breathe. These are subtle changes. And then what do you usually say? Oh, I don't exercise as much. I didn't sleep well the night before.
Right.
So so that usually happens. But if it continues to happen, that's really the indicator. It wasn't just an event. Now there's a pattern, and it's worth having a conversation with your doctor.
No, certainly. Here's our next one, which is, what are the top heart superfoods that you would recommend?
Well, I would look at it this way. It's reverse. Is avoid fats as much as you can do, especially saturated fatty acids, and avoid carbohydrates as much as you can. Then there's a whole slew of antioxidants, vitamin B12, thiamine, and so forth. So it's the combination of both. But you can take all the super vitamins, if you will, the antioxidants. But if you don't change your diet, nothing's really going to happen.
Right.
It's a little bit of everything. And needless to say, we didn't speak of this early on when you asked me one of the first questions when I said about exercising, decreasing your fats and all that. And this is worth mentioning. You have to stop smoking. Nothing works if you smoke. No, surgery doesn't work, stenting doesn't work, medications don't work. So all these things are not substitute. Let me continue to smoke.
Sure.
Okay. And what I tell my patients, every time you drag a cigarette, when we were in school, especially you and I that we were born before 1980, it's like Elmer's glue. It's like pouring Elmer's glue in your blood. It gets very thick, it gets very sticky. And when it goes through these plaques that we all have, it can precipitate anything. But nothing works. You're better off not doing anything.
Right. If you're smoking, then the rest of it doesn't work.
Because nothing works.
That's very interesting. That's good to know. The next question is the silent killer you mentioned, high blood pressure. We treat with medicine, exercise, diet. Any other recommendations you have to help lower blood pressure or treat it?
So whoever said that question hit it all. One thing is to lose weight. It all comes together.
Right.
But that's the cardinal effect.
There's no magic answer. It's all of those things together combined.
If there was a magic answer, then every single person will do it.
Right.
If there was a magic drug, we will all be in the same drug.
Right.
It's heterogeneous. What works for you might not work for me.
Right.
So be very careful asking your next door neighbor. This is very common in Miami. They tend to know more than the healthcare community.
Sure.
Do this or do that. It usually doesn't work. Everybody's different. And you have to tailor it to that person.
Okay, great. Here's another question. Is it true that grapefruit or grapefruit juice help lower cholesterol? Are there any other natural foods like that you would suggest to help lower cholesterol?
The omega-3 fatty acids in that family of over-the-counter drugs. Grapefruit, in addition to that, also lowers your blood pressure a little bit. Okay. But again, these are things that make a difference early on. So for example, blood pressure, when you go see your cardiologist, is divided into a couple of categories. Is it diastolic, systolic, and is it mild, moderate, or severe? If you're like moderate or pre-hypertensive, a lot of things work. A lot of things over the counter work. But if you have moderate or severe hypertension, yes, you're going to have to do all these things, but they're not going to correct the problem. You missed that boat already.
Right.
You got to do other things, and there's where the drugs come in.
Right, where you need to start taking those into effect. What are your thoughts on keto eating, on the keto diet?
I don't have thoughts on those. I don't even I don't
even know exactly what the keto diet consists of. So
well, it's kind of like starving yourself and other things. I think that if you're going to do those types of things, you should have first. You should have to be checked by your doctor. Make sure that you don't have an unknown type of disease going on, that your kidneys are well, and your liver as well. And then it should be somehow regulated, because they do have their draw, their negative side effects. It's but I know little about it. I think that exercising and losing weight slowly and progressive by modifying what you're eating. If you have any type of hormonal deficiency, that in particular reference to men in the whole testosterone conversation, and exercising regularly, decreasing your salts, that over a long course of time, it's a very healthy way of doing it. These other diets are like fast ways of doing it. It just has to, I think that the take-home message should be, do it under the supervision of a doctor.
Got it.
So you don't get in trouble.
Let me switch gears here a little bit and talk a little bit more about kind of the Jackson Heart Institute and yourself. What drew you to this profession? What made you want to become a surgeon and specialize in this area?
When you're going through, so you go through college, medical school, internship, residency, then a couple of fellowships. It's a long road.
Mm-hmm.
For me, for example, it was 22 years. It's a mirror image of what you said. You don't really select the specialty selects you, and a lot of it has to do with personalities and what's easier for you, what you understand. It's interesting, and slowly you get bundled into that you were meant to do. It's not so much that you can say, I want to do this. Maybe nature has another completely different plan for you.
Sure.
So that's the way I would answer that. I would answer that question. What drew me to the Jackson Heart Institute? Well, this is a very unique place. I've worked, and my partners, if you put all of us together, there's 10 open heart programs in Miami. There's 12 in Broward, and we have worked in the majority of them. Certainly, except for the Baptist Health System, everyone here in Miami. They all have their limitations. That's the key word, their limitations. Jackson has no limitations. What we can do here, you can't. If we can't do it here, it just can't be done. It's as simple as that. And it doesn't really matter the way everything is structured. If you have insurance, if you don't have insurance, if you're black or white, whatever your religion is, it doesn't even matter if you're coming from another country. It's a very warm and giving place. People don't even fathom how giving this place is. And you can help everybody equally. There's no stratification whatsoever. And that gives a physician an enormous comforting feeling. I don't have to worry about a balance sheet. I just have to worry about taking care of a patient.
Hi, okay, we're back. We're sorry, we had to move. There was a technical difficulty. So we're sitting somewhere else, but I wanted to continue because we have a few more questions. So this question just came in, and it said, can you please speak as to the coenzyme Q10 with regards to taking statins?
Okay, it's not a replacement for statins. That's what's important. So early on, it helps like the omega-3 fatty acids and so forth. But the thing is not if you're taking statins or if you're taking the CoQ10. What's important is that you're under a care and you are following your levels. If it's working for you like the omega fatty acids, that's great. But if it's not working for you and you do have a cholesterol issue, then you have to really consider taking statins. And then you also follow it. It's not, I'm taking statin, everything's back to normal. Sometimes you're taking statins and it affects your liver. So it's about doing something and following it, and then deciding what is the best treatment for yourself.
Let me go back to asking you a little bit more about the Heart Institute. So if one wanted to see a physician at the Heart Institute, can they access that from all of Jackson hospitals, or is it only at one of the hospitals? How does that work?
The Jackson Heart Institute functions primarily in Jackson, Maine, but it's connected to the whole empire. Okay, and there's different ways. There's through the web. We have a 1-800 number, calling the practice directly. Just calling a general information desk, it'll trip you somehow into the main Jackson Institute, and then we will give you an appointment. Maybe we'll bring you straight into the hospital. So whatever we have to do, to get you here early on, and then determining what we're going to do. We do it also in a group format. So is the surgeons, cardiac and thoracic, is the cardiologist, the electrophysiologist, the general. We come together and we treat the patient in a multidisciplinary approach. So we find the best treatment for that patient is not done in a vacuum where doctors don't communicate with each other. Here, the communication is above all stead. Okay. And we really tailor everything to each patient, not a one size fits all.
And so a patient doesn't necessarily need to be referred by their primary, right? It depends on their insurance, but a person could pick up the phone and call if they felt that they needed a consultation.
Absolutely. It could be through a referral. It could just be that it's also in the news. And you're in control of your health. And you can ask for a second opinion, a third opinion, whatever you like. But the door is always open. And even if we're not involved in that insurance process, that's also not an absolute no. We'll try to work with their insurance to give us exceptions all the time, and then maybe we could see them. So all you have to do is place the call. Then we'll do all the legwork for you.
And my last question is, what is your vision, right, for the Jackson Heart Institute? Where do you want to see it in 5 years?
Okay, so this is one way of describing that. It's a true comprehensive center. It's a one-stop shop. It's a center that will provide all the services from the time that you're born to, God forbid, if you need a heart transplant, an artificial heart. That is a true comprehensive center. Comprehensive, it's a nice term referring to as complete. So you don't have to worry about coming here, going there, what you don't offer. No, we offer everything under one umbrella. And that's a great comforting feeling for the patient, because we've all had the situation that we see a doctor, then we have to see another doctor, but he can't see us in 3 or 4 months.
Right.
We have this established even in our clinics, that there's different specialties working at the same time, and and everything is taken care of. So the answer again is a true comprehensive heart center for South Florida.
This has been great. I know I certainly have learned a lot. I know personally my cholesterol level's a little high, so I'm not going to be looking at ways to affect that and how to make those changes.
Mine too, but I do take statins. The diet didn't work for me.
I appreciate it so much, you taking the time, Dr. Segurola, to spend with us and with our supporters. And, we hope to be able to do more of these things in the future. And we're really grateful for your time. And if we have any follow-up questions from any of the participants, we'll certainly get those to Dr. Segurola and we'll get them answered and send them out to you as a follow-up to this conversation. So thank you to everyone for participating. And until next time, we'll see you in our next segment of Conversations in Care.
Thank you very much for the opportunity.
Oh, no, it's our pleasure. Thank you.